trying to get that bucket. It's not working. All right. Hey, Scurry County. It's the County Judge, and we're going to do things a little bit differently today. I've got Anna Hartman. She runs the Scurry County Health Unit. I forgot who you were and what you were doing.
Me too.
I've only seen you every day this week,
Exactly.
though. I've got Bill Dickinson, Lab Director for Colvin Memorial Hospital. Do you have a different title, or is it Lab Director? Or
That's fine.
how many titles do you have?
No,
30?
no.
I know you do a lot.
He did.
And Kathy Goodwin, Director of Nursing at Colvin Memorial Hospital, and Nathan Hines, the Assistant Emergency Management Coordinator. I've also got Roger here with us from the paper. You can't see him, but he is here, I promise you. So we're going to go over some things. And the first thing, I'm going to read a little bit of what I've written out, just kind of goes over what has kind of preceded us to get to where we are now. It has been a crazy week, and some answers we've been trying to get, we haven't been able to get. We finally have some of those answers. Some answers we still don't have, but we're going to give you as much information as we can. So on Monday, May 25th, as part of Governor Abbott's initiative to test all nursing homes in the state of Texas, a team came to Scurry County to test Snyder Oaks Care Center. Scurry County Sheriff's Department had one employee who had already tested positive. So at our request, and since the first team that came through had a positive outcome, when they came through the first time, it was a positive experience, okay? So we asked them to go ahead and perform the drive-through testing for our first responders. As you know, this past Monday, June 1st, 8 of those first responders tested positive for COVID-19. These positives came from that drive-through testing on May 25th. We believed it possible that 8 out of those total tested could be positive. So it just sounded realistic at that time. Sheriff Trey Wilson, the health department, quickly had those tested positive quarantined and began contact tracing on those individuals on Monday. 41 direct contact tracing was done, and those were they were identified and asked to self-quarantine. That was all done, like I said, on June 1st, Monday. Keep in mind, not one of the 8 positives showed any symptoms of having COVID-19 at all. So then Scurry County Health Department, Nathan Hines, Assistant Emergency Management Coordinator, and I reached out to several state agencies to try to get the result of the Snyder Oaks on Monday, June 1st, and we didn't have any luck whatsoever. So sometime in the evening of June 1st, Snyder Oaks received directly results stating that there were 39 positives. We didn't actually get those results until Tuesday morning.
Correct.
And then we started scrambling, trying to figure out what was going on there. So once we got those results, you started doing contact tracing immediately.
Well, we didn't do the contact tracing. What we did, we started with the investigation.
Yeah.
And so what we did in the process was to see if there had been any recent hospitalizations, if there had been any deaths, anything like that. We started with that. And we started to see exactly if it was staff members or if it was residents, what it actually was.
Right.
And during that initial investigation is when we found that there would be roommates, one would be positive, one was negative.
Mm-hmm.
And it was just so sporadic. Not one person was symptomatic out of any of them.
Right.
And as I said, no hospitalizations. There were just too many red flags to not stop and see what was actually going on.
Right. Yeah, that makes absolute sense as to why we went the direction we did.
Exactly.
So that's when y'all got involved, correct? Is when you contacted them and said, we no symptoms and we have all these positives. And so where did y'all jump in, Bill, at that point?
Well, we were asked to, first of all, we were informed of the positive information, and then we were informed by actually a request from the Snyder Oaks Care Center saying they were interested in seeing if our hospital would be interested in collecting to verify the positive results that were there and only test those people. And through different communication, we were able to accommodate them and do it immediately that day that he requested. And so we went out there, collected the specimens, tested them, and sent them out to Microgen Diagnostic Labs in Lubbock, Texas. They tested it, they resulted it that night. So it was collected, sent at 2:30, got there around 4:30, resulted at about 9:30 at night, and all 39 of them were negative.
This was on Tuesday, correct?
This was on
This-
Tuesday.
Right, okay.
Okay, there's a couple that we're unable to get results from, but for the most part, I'd say 98, 99% of all the people that were considered positive were retested and they were negative.
Right.
So of course, I have great value in this company, and I know those tests were reliable tests, and so I reported the results out to the Dana and the people at our hospital, and then Dana took it and she flew with it, and then you take it from there.
Well, what we did, anytime you have something like that, you have conflicting tests. As per CDC guidelines, state guidelines, you want to turn around and do another test within 24 hours if possible. That way you actually know, because the PCR test that Bill is talking about, that is the gold standard. And so what we did, we went with that. We decided, okay, we have a positive, we have a negative, so let's do a 24-hour again, just to actually see where we were.
Right.
And just to see, validate that test.
Right, and so in the meantime, we're hearing rumblings from around the state that there are others that are getting all these positives in the nursing homes.
Right.
And I was on a call at 1 o'clock on Tuesday with DSHS and other county judges, and they were saying, we have these. I came in a little late, but they were looking into the anomalies of these tests, why they were getting so many positives when there were no symptoms at any of these nursing homes. And you were starting to hear some of that too, weren't you?
I was, through our association, we're actually a member of an association that is health departments all around the state. And I had touched base with them. I actually sent out an email to the association, for one thing, asking for guidance, and for another thing, to see, okay, have you had this similar problem? And sure enough, they're like, wait a minute. And so we started piecing things together by working with all the other health departments and the health authorities and things like that.
Right, okay.
So that was how that came about.
Can I add something?
Absolutely.
I will say, the day the results came back and the nursing home got the results, immediately the state of Texas came out and visited the Snyder Health Care Center noon that day. And the administrator asked me to come out and visit with them. So we had a good conversation, and we're comparing their investigation regarding where I do my testing, how do we collect the specimens. They were determining the processes that we were doing compared to the processes they know that they've already done, just to make sure it was an apples to apples process, what analyzers we were using. They were just trying to investigate on their end. We provided them the proper information. I knew that we were golden, and I knew the analyzers that we had were top of the line, gold standard, and I knew there was nothing that could persuade me differently. And so because of that, they were very, very receptive. They actually were really amazed at how well we had our act together. And with all that said and done, they took it, and we had to wait 24 hours to recollect the second. So we can talk about that when you're ready, if you want to.
Well, in the meantime, just to get all the timeline together on this, as I received a call that evening late from Dr. Joel Massey. He is actually the regional medical director for Region 2-3. And he had been on a conference call with the other regional medical directors across the state, and they actually were discussing our case, and they were discussing the issues, and he was extremely complimentary about everything that we did, how proactive he was. He said it was amazing that Bill did what he did as quickly as he did, that we were able to get this turnaround. And he did say, in that, he said, we know that there's an issue. And he said, we are working on it. We are currently investigating. So as Bill said, they were very receptive. This could have gone really well or really bad.
Absolutely.
And state, they were very appreciative and worked with us. And as I said, he was very impressed that we were able to catch it like we did.
Yeah, that was a quick catch.
So
It
that
really
was.
Same day. I mean, you catch it the same
is.
day. So we had retests.
Yes. You have to wait 24 hours. We were going to do it that next day, but they said to wait 24 hours. So waited 24 hours. And of course, we collected them yesterday, and the results came back last night, and part of them came back this morning. And they all negative.
Yeah.
So we're real happy to have that outcome.
Mhm.
And so, and the results are all back at Snyder Oaks Care Center with the administrator there. So I hope he's happy, because we really did a great turnaround time. I really appreciate the microgenetics lab for doing what they did.
Absolutely.
And I also want to add, during all of this, Snyder Oaks staff, they went above and beyond. And
They sure did.
from the time that I first contacted them to even initiate an investigation, they had already quarantined a wing.
Right.
They had already put all of the proper procedures in place.
Mhm.
They were doing everything textbook.
Good.
I was very impressed that they had the response that they did,
Mhm.
and that they were on top of things from the moment they found out.
Yeah, that's great. That is absolutely great. In the meantime, when all of this is going on, we're also getting confirmation from the state that, let's see, DSHS recommends that no actions be taken in response to the test results from this laboratory, the one that got all the false positives. There were over 14,000 tests through that laboratory for nursing homes, and they, like I said, they found nursing homes throughout the state who were getting these false positives. So they said if we should not quarantine anybody out of those testing, out of those false positives. So what's going on at the hospital with all of this at the same time? I know y'all were dealing with quite a bit of this as well.
Well, mainly the hospital involvement in this particular situation was the lab testing and retesting, and that really fell on Bill and his staff. And as they always do, they really rose to the occasion and got it done quickly and well.
Very good, very good. And Nathan, you were on the phone with the
Yeah, we had just at the fire department, we had one guy positive, false positive, thank the Lord. But we had to quarantine 5 of our guys that are full-time drivers and paid guys.
Yeah.
So that left 4 of us, and then the volunteers stepped in and helped drive trucks too, while the other 5 were out. So I'm proud of all of our guys. Everybody did great.
Yeah.
Everybody stepped up, and PD was the same way. So we were pretty shorthanded. Kept trying to get a hold of the state, saying, this could be a life safety issue if we have a major event in Snyder.
Absolutely.
So they started answering questions pretty fast after that. So
That's good. That's good.
Well, that's one thing that it's hard for the public to understand, is whenever you have a positive person or positive case, that's just not taking that one person out. That is taking any of their contacts that they have been around. That's also taking them out,
Right.
either with quarantine or with self-isolation or anything like that.
Yeah.
So, like, as Nathan said, just like with our law enforcement center, whenever you have that number of employees, that doesn't sound like a lot until you start looking at contacts. And so once you start looking at those contacts and going from there, it can grow very quickly.
We had a lot of calls that day from people so the family member, the patients were contacted at the nursing home, and they contacted their families, and then of course, everyone they've been in contact with, they started, reporting that they were positive. So we did have a lot of phone calls from people very concerned that they had been in contact with someone that was a positive. We did a lot of testing because of that, not nursing home patients, but our own staff, and did a lot of extra testing due to that. And we had to send some people home until we got the negatives back. So we too, our home health department was especially hard hit. I believe we had to send three of our nurses home that day.
Yeah.
Because of exposure to some of the nursing home patients. So it did create a lot of havoc there.
Yeah, absolutely. Absolutely. All right, and I know you've got to go here pretty quick, so let me get to some of these questions. So the 800, and these are Roger's questions, so do you mind if I read these real quick? Okay.
Sure.
The 840 tests administered that you announced today, same as yesterday, these are yesterday. Does that number include the extra tests performed at Snyder Oaks as multiple tests? For instance, if a person at Snyder Oaks tested positive initially and then tested negative, would that count as 2 tests administered or 1? When he or she is retested today, his or her 3rd test, would that count as 3 tests administered or just 1?
Well, let me you're talking to probably the second person who can answer that question. the first person that can really answer that question is through Kristen Perez and Dana. So I'm punting it over to them.
There you go, that's perfect.
Why did I know that was? I will answer this quickly. As of today, we have already tested over 1,000. There have been 1,000 tests that have just gone through Bill's lab, through Cogdell's lab, which is unbelievable for a county our size. So with that being said, once a person is a confirmed positive, then once we follow them, we retest them at a certain period of time. And if they become positive, if they're still positive, that means that they're not cured. But that does not go into the count. What that does, it's just one case that we're following that we're trying to get cured. So we could test that person up to 4 to 5 times if need be.
And it'll go into the total tested, but not necessarily into the positive
Right.
again. It'll be positive once, but in the total tested, it could be 3 or 4 times.
Correct. And that's where the numbers, we are actually going to change the way we are reporting, and that's the reason for that. Because we can put number of tests, but even if, once they go from pending, they're positive, but they can't go into that positive count, and they're not going to go into that negative count. So that's where those numbers get off.
So that number is the number of tests that have been administered, not the number of people that have been tested.
That's the number of tests administered, correct.
Are the COVID tests still in limited supply because we're expending 3 tests on each of these people? So the first test that was done was not done with our supplies. Those were done with supplies that were brought in with that team. Now the second and third tests that were done that we are showing negative, those were from our supplies, and I'll let you answer from
So right now, our supply is, we have like 1,300 nasopharyngeal swabs. We have about 1,300 viral transport media, and we are good. We are nose ready.
I can attest for 2 of those. All right, is it only the 39 positive from Snyder Oaks being retested, or was everyone originally tested there being retested? So everyone at Snyder Oaks, were they all retested, or just the 39 positives? Are the folks at the LAC who were tested the day before being retested? So you just retested the positives, correct?
You are correct. And as far as law enforcement, they had just the law enforcement people come back.
We did.
Yeah.
Because what we did originally, whenever we got the original 8, we took that at face value, is what we did. We initiated our contact investigation. And as the judge said, there were over 41 that we submitted for testing from those original 8. We went with that, but once we got that unbelievable count at the nursing home, that was whenever we were like, wait a minute, something is not right here. So after the first negative that we received, we made the decision, let's go ahead and test those 8 that were initially positive also with our first responders, just to make sure. And sure enough, after all of that work, they were also a false positive.
Right, and we got word from Dr. Massey that they could go back after they got that initial negative.
Exactly, yes,
So,
Can I jump in and?
Sure.
ask?
absolutely.
Sure.
Is there any possibility that any of the other people in the county that have been tested are false positives? And also, is there any possibility that there are any false negatives? I mean, could some of the people that tested negative actually be positive?
Well, I can answer that.
Good.
We at our hospital know that the test methodology that we're using is reverse transcriptase polymerase chain reaction testing. And that test is very, very, very good. I mean, it's like 99, 100% sensitivity specificity, but it is the collection of the specimen that we have an issue with. If you collect an oropharyngeal sample through the mouth and test for coronavirus, it's only a 32% probability that you're going to get a positive. I mean, it only picks up 32% positives. If you collect from a nasopharyngeal, that percentage increases around 68%. If you go through a sputum sample, it goes up to around 72%. If you go through a deep lavage, bronchial lavage, actually go into that, then it goes a little bit higher, I think over about 90%. but just the proper collecting of the specimen. So we know that the collection of the specimen is so highly important, and that's probably the most important piece of it. Unfortunately, we can't all do aspirations of the lung. We can't do really sputum samples because we can't cough that stuff up. So the next best thing is the nasopharyngeal. But take in mind, we're talking 68% probability of getting positives. So having a false positive, a false negative, sure, that could be, but we're doing everything we can because that's just the way to collect the sample, just in general. Because they love to live in the cells that are in the lungs. They're parasites, they're RNA parasites.
Well, and what we do along with that, to answer your question also, is that once that person is tested, and if they have a negative, they're still followed for 2 weeks after that. Because if they're tested for a reason. And we want to make sure that they don't become symptomatic or if they do become positive during that 14-day period. And so there's a process. Even if there's a negative, we still try to follow through with that.
And that's just not our hospital. That's just all across the nation.
Correct.
Those percentages are the same all around. So we all understand that's why we had the quarantine. That's because we don't have the definitive boom.
Right.
So, and she's doing everything she can to keep people, what do you call that terminology?
Herd immunity, and I call it
So the
herding
concern
cats.
is usually more for the false negative than a false positive. So it's really an unusual, we're not really looking generally, we're not really concerned in general terms about a false positive. We're more concerned that there's about a 30% false negative rate. So this nursing home results were really out of the norm to be, so have so many false positives.
You have any further questions?
That
Were
were there,
you covered?
oh, okay, that was okay. I don't think so, I think.
Okay. All right. Well, to give you the numbers, I know it's at the very end, but we have 26 total positives, 24 are current. We had one new test today, male between 30 and 40, correct? And so we have 2 recovered. So 24 current cases. All those other numbers come off our total tally. Well, not all total tally. They go onto the tally, but they're going to be as negatives at this point. We had them in pending up until today. They're no longer pending. They're all going to be negatives. So with that, thank you, Dana. Thank you, Bill. Thank you, Kathy. Thank you, Nathan. And thank you, Roger. Appreciate y'all all being here. If there are any other questions, feel free to ask. If not, I think we're okay now. I think we're kind of going to be able to get over this hump. It's been a crazy week.
Did you mention how they're going to change the reporting on the?
I did, but I'm not sure. I'll probably need to go over that again
Okay.
because, as I said,
Yeah.
we are going to be changing the way that we report, and we're just going to be doing the actual confirmed cases.
I think the total positive,
Right.
then the active and
Right.
recovery.
Yes, we're going to do it. We will do it that way because the numbers as far as testing are just going to continue to climb.
All right. Well, thank y'all. I know you got to get Bill, so
Okay.
I appreciate y'all's time. See y'all next week. I won't be here Monday, so.
Okay.